All right. Hello, everybody. I hope you are all out there listening. This is going to definitely be an important show, a serious one, not the usual flighty, just laugh thing. This is MBIWAN MONJIMBO coming to you on Vosaworld Radio, and I have with me a doctor, a medical doctor. Her name is Dr. Brenda Tanyi Tal. I'm going to have her tell us a little bit about herself. So if you have to introduce yourself to our listeners, what would you say about yourself in a nutshell?
Nutshell, Dr. Brenda Tanyi Tal, as you rightly said, I am a mother, I'm a wife, and a medical doctor. I've been licensed, I've been practicing for about 4 years. I also have, I currently work in the LAQUINTINIE hospital in DOUALA. I also have about 9 years of experience in civic engagement. I volunteer in a good number of organizations that seek to curb maternal mortality. I am instructor of ALSO. ALSO stands for Advanced Life Support in Obstetrics, trained by the American Academy of Family Physicians. I, moved to the various suburbs of Cameroon to teach maternity care teams on how to handle obstetric emergencies. I am the leader of Women Health Committee.
Oh, wow.
We health campaigns. We go out to the suburbs of Cameroon to provide basic health services to the people there. And what else? I do a little research. I publish in the American Journal of Internal Medicine.
Oh, wow.
Yeah.
That is, I'm almost sorry. I'm almost regretting why I asked you the question, because that is a whole lot for somebody who is just how old? How old are you?
I am 29 now. I'm 29.
Oh,
I
wow.
turned in 3 months ago.
Wow. That is a lot to have packed into that amount of time. Okay, before you became a medical doctor, and I like the way I noted as we're listing, and I said, who are you? You didn't say the medical doctor first. You said, I'm a mother, I'm a wife, I'm a medical doctor. That says a lot right there about how your priorities are aligned.
Yeah.
Very impressive. Because for some people, it's I'm a doctor. In fact, if you make a mistake and you don't call them doctor, they really get mad. That is how they define themselves. So that's interesting. I noted that as you said so, and I was like, I'm going to mention that. That's really good. That's very impressive. All right. Okay, before you got to doctor, where did you train to be a doctor? What institution?
I went to the Faculty of Medicine and Biomedical Sciences. It's what they call XQs, what they used to call Qs in those days. It changed to the Faculty of Medicine and Biomedical Sciences. It's in Yaoundé. So yes,
Oh,
that's where I was.
interesting. Want to tell us what it was that how before you got there, prior to that time? And I know I'm asking the question. The school, so people can actually kind of situate where it is that what the rest of your upbringing is academically and socially.
Oh, okay. Like which secondary schools I went to before going there?
Exactly.
Oh yeah, I went to Seka Baptist College. I was there for my first year, and then because my twin brother was in the Northwest in Sacred Heart College, I moved on to Bamenda too because twins always want to be together. So I went to Our Lady of Lords College, and I was there until upper sixth. And then after that, I sat in for this medical concours we have. A series of concours into medical schools, and I got into the Faculty of Medicine and Biomedical Sciences piece. So, yeah.
Right. Now everybody knows exactly what I was asking, because I found people like you two-side cutlass in a good way. In other words, you started at Seka Baptist College, so you're a Sekerate, like I am, but then you moved on to Our Lady or Lord's College, so you are a lesson as well. So that's where I was getting to. And so, yep, but those are stellar schools. That's a good education that you got, and you have followed through with it and come out to be a medical doctor. So, well, there's some people for whom medicine is another job. It's going to pay well. I'm going to have the prestige, and that's how they look at it. Is that the case for you, or was medicine always something you wanted to do from the beginning, or did you just say, might as well go do that?
I would say I've always wanted to do medicine. I have my little diary. I just kept it somewhere there, but I from very young, I was just very passionate about a few particular things in the community. One is the, pregnancy-related death, death or to things like postpartum hemorrhage, which is bleeding post-delivery, and a good number of issues in the Cameroonian health sector, which have to do with infection like malaria, like tuberculosis, all those kinds of things. I just really had this desire to change the narrative in the public health sector. Because we had very high rates. Currently, we have deaths to maternal mortality in Cameroon that's at 582 deaths per 100,000 live births, and deaths to infectious diseases at 46.2 of all deaths in Cameroon. It's quite high, and it was even higher in those days. It keeps getting better with time as we get into fighting these ills. So yeah, I've just had that passion little, and I started doing little things. Organizations. I set up my own little organization where I was in medical school, and so I co-founded it.
That's really impressive. And I was going to say that we were growing up as children. I've been on this planet for over half a century. We were talking about, before me, they were talking about maternal mortality, infant mortality. In my time when I was in lucid and well enough read, and we're talking about maternal mortality, infant mortality.
Yeah.
And I'm still here, and it's still an issue. It's almost like, I'm glad I heard you mention that it's getting better, but you would have thought that by now it would be a thing of the past, even if not completely of the past, because if it comes to that, you have women dying in childbirth, even in the developed world, in developed countries and things, but you would not have thought to hear those numbers that you just said right there. That is really sad, that a thing as basic, as important, as sacred as giving birth is something that we should be worried about. In some places, you're worried about. I'm sure with your research that you've been doing and being out there in the community, what I'm about to say here will not be strange to you. But there were times when people just knew someone was expecting a baby, and you were not sure that baby was going to be there, so you actually gave them names. Either they don't even pick a name for the child already, so let us wait until that child will really be born, or because they expected the child to not live long, they give them the most ridiculous names, because they're like, this one is not even going to be here. I don't want to get attached to the child. The child will die soon anyway, which is really, really, really sad.
More delivery maneuvers, the child comes out, disabled, or it was a serious issue in those days, and we're happy that it keeps getting better time. So and so you work at LAQUINTINIE there. That's where I have two children. My son was born right there at the time. I'm just curious now to know about LAQUINTINIE in particular. People know the name very well. Some dread it, some love it, some respect it. At the time when I went there to have my son, I wonder if that is still the practice. You pretty much have to bring your own stuff with you. I brought from the band-aids to the gauze to the everything, syringes and stuff. Is that still the case now? Yeah, there are a series of things that the hospital will provide, and then there are some things that you have to come with, like for example, the baby's clothes, obviously, maybe a few diapers, and so a few basic things, but the rest are provided, so you just pay for.
Okay, that is a welcome change. That's a welcome change, because I remember having to, you have to remember the labor pains kicking. You're going to find a little bag that you're prepared to bring it with you to hospital. That's a welcome change. All right, so now we do know that we have this maternal mortality thing, infant mortality issues. What would you say is the root cause of them? Why do we still have the problem being such a significant issue in Cameroon? Why?
I will
Is it that mothers don't get the prenatal care?
Exactly. I will go in all directions. I will start first of all with knowledge. Many people would not do their prenatal consultations, especially in the suburbs. They don't really bother about it. They just know that I mean, they get advice from their grandparents and all that. It's a normal thing, and they don't do any preparations, they don't do any vaccines, they just show up on the day of delivery. There's that. There's the fact too that in some health centers, especially in the suburbs, there aren't enough medical personnel, and the personnel that are there are not trained enough. You just have a midwife in an entire hospital. You don't have doctors, you don't have gynecologists. So some specific kinds of complications like what shoulder dystocia. Shoulder dystocia is when the bone-to-bone impact of the anterior presenting part of the baby against the pelvic bone of the mother. So some kinds of maneuvers, because you have to do, yes, it's some kind of maneuvers to be able to deliver that shoulder without any complications. If not, the baby is born with a nerve problem, or several other things. The mother can be, have an impairment for life, or a paralysis. So there's a need for personnel to increase. There's a need for the people to be educated about what to do while they are still the baby is still there, antenatal consultations and all. Yeah.
Mm-hmm. That is, and so I'd like to know a little bit more now, because you mentioned it when you were talking. I said, okay, tell us who you are. You started talking about it, the programs that you run and what you do personally as Dr. Brenda Tanyi Tal to try to fix this, to try to remedy this situation. Clearly, it's bigger than any one person, but I have seen on Facebook there how you put seminars and things. Plus, you've even been traveling back and forth around the country, giving seminars and stuff. Tell us a little bit about the work you are doing, even with just 4 years of being on the scene as a doctor. What you've been doing. Let's hear about those programs. I'd love to hear about them and probably how we can support them.
Okay. Well, I'll go back to while I was in medical school. I co-founded this organization, the WeMed organization. It's it's an accumulation of medical personnel, medical doctors, and medical students. We went to the suburbs and tried to organize health campaigns, health talks, talk about prevention.
This is like in villages, in like some rural areas.
Banso, for example, in Kumbo, we went to Fontaine in Lebialem. We've gone to a series of places, and we did those health campaigns, those health talks. First of all, we did free medical consultations. We provided medication to be able to raise the funds for that. For example, we had to go to Jangi houses, for example, Banso, they really like themselves, so it was easy to get them to contribute. We had to go to organizations to present our project, what we wanted to go do. We had to, meet a few politicians, raise some funds for that. That was in medical school. So we were able to, like, for example, the health campaign in Bantu was quite good. We reached out to about 400 to 500 people with both health talks, consultations. We did minor surgeries, like, we were able to do the little we could. That was while I was in medical school. Later on, I got trained by the American Academy of Family Physicians on how to handle obstetric emergencies, what we call an advanced life support in obstetric instructor. There, as an instructor, we go to various regions of Cameroon. We try to organize seminars and all. We teach maternity care things, the doctors, nurses, gynecologists, how to handle some specific obstetric emergencies that are not known, how to use, for example, mnemonics, because there are so many, but once you're in a critical condition, you have to try to remember what to do. We even have like some kind of posters that we share so that they can put in their maternity, in their wards, in the labor room, so that they can remember, for example, the shoulder dystocia, you have to use the helper. Mnemonic helper stands for HELPERR. It stands for help, calling for help, doing some things, checking for episiotomy. E is for checking for episiotomy, for example. Episiotomy means is there a need to cut in somewhere and, open the delivery inlet so the baby can come out. That is for E. L is to lift up the baby's legs to be able to, increase the canal. P is to be able to exert a pressure on the pelvic area so that the bone can be, can come out, the the shoulder, sorry, can be able to be released from the
Released.
impact of it. Yes. So there are many things we do those mnemonics for them to be able to remember.
Right.
And
You're talking to a teacher, so trust me, that is what we tell. You remember that, especially when you're in a panic now, the situation is in front of you. That's not the time to say, hold on a minute, let me go to my textbook and go and read up on what it is I should do right there. But that's something that can come to your mind and you say, okay, this is what I'm supposed to do. Like even here,
you can imagine in those kinds of suburbs where there are only midwives, at least they can deliver some kind of emergency. So we've had a great impact. There's this great testimony in Bopi Baptist Hospital, one of the hospitals that for the last 6 years that this model was taught. They've had about 30,000 deliveries, and so far with the records, they've had only 15 deaths 15 maternal deaths since this program was taught. So you can see that it's a great improvement.
Clear impact.
Exactly.
Awesome.
So
that's awesome.
Yeah, so that's also they're a good number. I work in the Always as a consultant, medical consultant for the Always Care Foundation. We do grant researches. We also go to orphanages to do orphanages, a few health centers to offer medical consultations, distribution.
Those are done free of charge for the.
Yes.
That's really good. That's really good, because those are the people who cannot, otherwise they cannot afford the care. And any life you save, even if it's one life you save in I don't know how many years, it is still important. That's one life less than we have lost. And we are not here, we don't know people's destinies. That's somebody whose life is preserved, who's still on this planet, who is going to go ahead and impact the world somewhere because of the fact that their life was saved in this kind of way. Because the things that I'm listening to, you have occurrences like that in every country, but nobody really sits here getting pregnant and going, oh my goodness, I'm so scared. No, they expect to go to the hospital and have a baby. It's instead, the exception is when things don't go well, because normally things just do. You see, I came here and you know what struck me? The first time I was told, oh, there's a baby shower. Now you all are modern, and I'm sure you do baby showers even in Cameroon and stuff. That is a recent thing. Baby showers are not part of our culture. And when I thought to think about it, I said, I wonder why, but the answer is obvious. Yes. You're doing a baby shower. Are you sure that the parents are going to go to full term with the pregnancy, number one? Number two, are you sure you're going to survive the delivery? And that kind of thing. So it's almost like, don't jinx it. Who don't even want to say that they're expecting you? And I don't say anything, because you don't know what's going to happen, and you don't know. So we have a whole culture where we worry. If pregnancy, you only start to rejoice and do a born house and a pikin planty and all that soap and oil. After the fact, after the baby is there, you've taken your 2 eyes and seen that baby. The baby has some teeth, and they're walking around the place and are creeping or crawling before you even dare rejoice. True. And that's part of that issue. I think that I concluded to myself that has to be the reason why our culture doesn't have that kind of anticipation of the baby is coming, because that may have been the fact that, how are you sure the baby is coming? How are you sure the baby is really going to be delivered safely? All right. So what career-wise, you're working at LAQUINTINIE Hospital right now. Is that where you plan on being for the next 2, 3, 4 years? What are you looking at down the road?
I plan to specialize. In fact, I'm glad I already got admission. I wanted to do a master's in public health. I've gotten admission in the University of Oxford in the UK. So I'm going to be kicking off with a master's in public health, and expand my knowledge in this specific domain that has to do with maternal mortality and deaths to infectious diseases, and get greater skills so that I can create more. And then
thereafter, after you've gotten that in Oxford, no less, which is nobody needs to explain what kind of university the University of Oxford is. Do you plan on just staying there and there, or what do you plan on doing? Do you plan on coming back to Cameroon to come and apply what it is that you have learned?
I do plan to come back to Cameroon to apply these things, to create more impact, to reach out to more people, and hopefully even join in the fight at the Ministry of Public Health itself, kind of influence policy, you get involved in coordinating things that have to do with maternal mortality, because we have the coordination, we have the Ministry of Public Health actually has it's set up in different what can I say, domains, and there's this domain for maternal mortality and child health care. There is for infectious diseases and all. I plan to just try to do, create impact in those domains at the ministerial level. Once you create impact in the policy, it will be able to spill over. Exactly.
That is it. It will trickle down. It will trickle down, because if they have the policies are the big true, you can have a policy and nobody is bothering to implement it or follow up with it. But at least it's even worse if you don't even have the policy to start with. So everybody's just winging it and doing what they can do. Like, hey, what do we do here? But if the problem is recognized, policy at least has it down written, then you can at least counter the fact that some people will follow policy. And then you will actually start seeing an impact. And it becomes a problem, like you're saying there, when the policy makers are not in the field. I see it in teaching. You have somebody there who's sitting there in some office.
Exactly.
No offense to him, he's a brilliant individual, but he has no clue what life is like in the classroom. He comes up with a policy, and we are asking ourselves, we teachers, what crazy fellow came up with this nonsense thing that they're asking to do there? It does not look like this. It's not going to help.
Sometimes they're completing different domains. They haven't ever done anything in health, and they find themselves seated in those big positions. They don't know what to do. That's a problem that we can be able to handle. If I believe you can create impact right there, the policies will be different. Exactly.
The effects will not trickle down, and you'll see a clear difference in how things are implemented. All right. Is there anything now that
Sorry. I was going to say I also have this big dream. Much later down the lane, God willing, I've had this dream of setting up a very big hospital. I said it's going to be the largest Cameroon ever have. It's going to need networking, and that's why I don't plan to joke with my networks and organizations to set up this hospital where we have everything, equipment, everything. I mean, I was even thinking of helicopters and all, where you can easily get
where they can evacuate people who need to go.
And then people can also pay based on their financial abilities, because many people, there's the tendency that if you don't have enough, you're not able to get quality. Exactly. But I'm just looking at the means where you are not going to receive aid based on your financial ability, but based on the need actually. And I was thinking of crazy thing. Anyway, it will come down with time. It will.
But it starts with a dream. It starts with a dream. So it will come down with time. It starts with a dream and with a whole bunch of faith and prayer. That's what we know. And if that's something, why not? We see it happening in other countries. Things are improving there. We hope and pray for the same in our own country too. Because if you don't even have the hope, you don't even have the dreams, that's for sure nothing is going to happen. It's better to at least have the hope and have the dreams, and then things didn't quite turn out the way you wanted them. But at least start with that and see if you can see it, if you can dream it, if you can believe it, chances are that it's going to come to pass. It may take the amount of time may differ. How well it turns out may differ, but there definitely will be some change. Now, you said you are a wife, you are a mother. How do you juggle all of this? Being a medical doctor, doing all of these seminars and stuff, you're about to continue going to school and everything. How do you make sure that your home too is taken care of, baby is taken care of, husband's taken care of? How do you juggle everything?
I would say if you plan everything, you're good to go. I mean, I have my diary. I usually, for example, when I have seminars, I know where I plan it down in my diary. I know I'll have to cook a good number of meals before going down. And, it's just, if you plan well, if you make very good use of the diary, you'll have no problems.
So, so it's all about the planning and
Yes.
ahead of time, not just doing knee-jerk things like, oh, oops, so and so thing, you go do it now. So you plan well in advance and manage your time correctly. Because the reason why some people, believe it or not, why some people say, this doctor thing, I don't know whether I want my daughter to go do it or that kind of a thing, is they're like, big book, big sense, number one. Number two, how is that going to work for a woman? Luckily, in this day and time, that's happening less and less. You have a whole bunch of female doctors. But there was a time when what you're mentioning there was the problem. They'd say, okay, the person's not going to have time to do anything in the house. They're going to just be the doctor and forget to be the wife and not be a good mother. But you are proving that it's possible to do all three things.
Very possible. It's so much planning with my husband, for example, because he does supervision. We try to, for example, I'm supposed to be on calls. The times I'm on call, we arrange that he's on the day. You know, we just arrange our timetable so the baby is always taken care of. We don't have any problems here. So
that's awesome. That's awesome, and that also speaks to the quality of the marriage, that you put on the same page. Because if you don't have a supportive spouse, then number one, there will be actual concrete problems that, okay, how do I leave and go? There's nobody there to watch the baby. Concretely, you really cannot get up and go and leave your own child to go look after somebody else's children there and just lock the door with a little baby there at home. So, so you do have to take care of that concretely, but it also helps emotionally, because now you can go to work and have your whole heart and soul in them, because you know the child is in good care, it's in good hands. There's nothing that I could have done any better, because they have the actual child's own dad there. So that's definitely a good thing. What would you give a young child, a young secondary school child, male or female, but female especially, as advice? Somebody are thinking, maybe I want to go do medicine. What do you say to them? You who have gone through that path, what do you say to them? What would you take for them?
I would say keep dreaming. It's not impossible. Just have that in mind, because so the journey may be very shaky, because it's kind of difficult to go through medical school in 7 years and all. You may want to be tired and all, but you can, if you have it as a dream, if you have, it's good to picture what you want to see in the future. What is that mission? What is that vision? If you have it in your mind, it will be your motivation at whatever period of time. And it's very, very possible to make it and make it big.
So what kinds of things might you have seen between the time when you were at school and then the time when you actually graduated, that you're like, when you started now working on the field? Is there anything that you noticed and you said, I didn't see this coming, I didn't quite know this is how it would be? Anything that jarred you? I know before you become a doctor, you've gone on out there and done some things. Was there any difference between the training and the actual work?
Obviously, we once you've gone to the field, you meet more cases. Great thing is that you have the ones that were before you. We have your professors there. For example, in LAQUINTINIE, we have the elder ones. In the pediatric ward where I am, we have the pediatricians. We have even greater gynecologists, for example, where we can make references in for some particular kinds of cases that we cannot handle. We can meet them. We get to enhance our knowledge. Whereas there's a big difference between what you learn in school and what you see in
the theory that you read in the book, in any profession, the theory that you read in the book, there's like, when you actually get to the field and see it doesn't quite work this way. You have to actually figure out ways to make it work, I can imagine.
Yeah, it's just important to realize that there's always the elder ones there to fall back on. When you're stuck, don't try to want to do everything. No, we are all a team. We team up to form, to impact people. So it's always good to run to your team members for help.
Because with experience, that is definitely important, and it takes humility to do that, because sometimes you get out and you say, "Hey, I did 7 years." So you don't know. How do you think that the danger in the effect or the results of not doing what you're saying can mean the difference between the life and death for a patient? You really cannot
Very
afford
true.
to do it anywhere else, because okay, I don't listen to my supervisor in the school I'm teaching. The kid may fail, but that's not death. They may let you hopefully go and get a better teacher down the road who will fix things for them. But you don't
Yeah.
listen to your superiors or those with more experience here. Somebody
Yep.
might actually lose their life. So it's not,
Mm.
that's a profession where it's not like, oh, well, it doesn't matter. It does. It can actually be the difference between life and death for somebody. So we who are listening to you and we who have heard about maternal mortality, infant mortality, is that something we can do sensitization wise? Is this something we can do contribution financial wise? How can we, the people who are not necessarily doctors, who are not going to the actual suburbs like you mentioned, to the actual villages like you mentioned, what's our part in the thing that we can possibly do to help? Because those numbers that you gave there are troublesome, are worrying. What is
Exactly.
there anything we can do, the lay people?
Yeah, you can assist in with prayers, obviously, praying for us that are going down to the field. It's supportive. You can also assist financially. For example, in the Always Care Foundation, you have their website, the www.alwayscare.com. You see the various
It's always
contacts.
like ALWAYS, like the word always.
Yes, always ALWAYS care, like
Care.
CARE.
Okay, that's one word,
Exactly.
alwayscare.com.
Yeah.
Okay.
Yeah.
Mhm.
And you see the various contacts whom you can meet, your phone call, and if you're able to send your contributions, you will be glad to receive. It's going to help. It's going to go a long way to help us in the work we do. So
Okay,
yeah.
and another question. Another question. Do you ever partner with doctors who may be Cameroonian or otherwise, who work outside the country, to come and do any kind of help on the ground? I was just curious to ask if there's, because you did mention the fact that some of these places, some of these health facilities are short staffed.
Yes.
I was wondering whether there's any networking with doctors outside of Cameroon, where they may be Cameroonian or not, where they might
Yeah.
want to come, and even if it's periodically, when they are on leave or something, come and volunteer their time to help. Or
Yeah, we do. The Always Care Foundation has people that come over from different hospitals. There's this one in Egypt and all that come to volunteer. In the Baptist, with the Baptist hospitals, I have many different volunteers, surgeons, gynecologists that used to come over to assist mercy ships and all, to assist in helping out, giving their services out to those that were not able to take care of the bill.
yes,
Exactly. So
yes.
yeah.
So I'm glad to hear that it's not such a bleak, a hopeless kind of situation. That even though it is not where it should be, that at least progress is being made in that direction. And that those
Yeah.
of you who are in the field, you in particular, I can tell. Anybody listening to you and anybody who will eventually see you talk can tell that you're passionate about what you're doing. And when that
Yeah.
happens, then that's how problems get solved. Because this kind of person does not say, okay, I give up. If it works, fine. It doesn't work, fine. They want to go and try to make things better, to get things to improve. And that
Yeah.
is how that rate will reduce. You mentioned those numbers. I'm hoping that even if I talked to you in a year's time, 2 years' time, you'll be giving me reports on figures that would have significantly reduced, because things
Yeah.
that affect women, that affect children, affect the world. Every child is born of a mother. Every person on this planet came courtesy of a mother. So anything that affects them does definitely affect the world. Any community that's shaky in that domain um, is not that's not how it should be. But and
Yeah.
obviously, as you said, it's less in the cities and more in the rural areas where they don't have the staff to start with, and they don't
Yes.
have the facilities, and they don't have the what they need, the medication
Yeah.
and all. So I'm happy. Please let us know when the campaigns are out there. There's a campaign to help response. There's a campaign for sensitization. Are we doing posters? Are we doing? Back in my day, they actually used to have what they call. Do they still have PMIs, like PMI?
Yes, they do.
They still have those where the women used to go that they used to even teach them songs.
Yeah.
To
Yes,
learn about how malaria. They used to say malaria is a very bad sick. Those songs to teach them things like that, and we are smiling here, or we used to find them a little funny because we have an education. For somebody who's there, that really was it. That song that was taught, and that was really their own, all they knew. And now with the situations in the northwest and southwest regions where there is quite a lot of strife, I can only imagine that the situation is even doubly worse than when it comes to things like this. And any idea what's being done in those regions in this respect?
Well, because of the
Unrest and
unrest, there isn't very much that is done. Like, for example, we used to go to BRENDA to organize our seminars, and we used to call in doctors from different hospitals, regional hospitals, BRENDA and other little healthcare centers. But because of the unrest, we've not been there for some time. We've at least gone to Mutengene. The last time we had was Mutengene in February. We were able to invite staff from Boya, from Limbe, from Moya, exactly, to come over, and it was a great time. So yeah,
we just pray
had the rest. Yes,
we'll keep praying for peace and hopefully a time when, because with that situation, pretty much everything that already was a problem is even double the problem now because of it. It's something like healthcare. I can imagine that being, if you could not afford treatment before when things were, now you'll be even less able to afford it. If the places were understaffed when everything was kind of peaceful, now there'll be even less staff there to attend to issues that need help. So, yep, you said prayer. We will be praying. We have been praying that things will get better. So it was really, really, any final word that you'd have to say, because it's been quite a pleasure talking to you to just see where things stand and where you're going with this. Definitely already, I can only wish you the very, very best with your career as a person, with your what's coming in your immediate future. As soon as, when would you be leaving for this Oxford thing? How soon is that?
The course starts in October, but I have to be there in September because I got this scholarship from a leadership program. They start their program in September. So yeah, the Winifred Hoffman Shivning scholarship. So I'm going to be going for the leadership program they're organizing, and then after that I'll start with my course. So yeah.
That's awesome. And I hope that some young girl is listening somewhere and saying, hey, some young girl who maybe either went to Sacred Baptist College or who went to Lord's like you did, or who didn't go to either one of those two, but went to a secondary school anywhere, is sitting and saying, look at some young lady there who's done that. I too can dream. Or some parent who's listening, who's watching, sit and say, it happened to her, then maybe I could go ahead and just feel encouraged that they can also go ahead and pursue, encourage their daughter who comes to them and says, I want to be a medical doctor. You don't go like, where? I beg. You can see that people do it and do it well, and that what they actually do can make a difference. You should not only do that job so you get a paycheck. You can do it to actually make sure that lives are changed. So all the best with those dreams, with the immediate academic pursuits that you're doing, and then with the dreams. That day, I hope I live to see the day when that hospital with the helipad, with the helicopter touching down and evacuating people. I hope to see the day when that really does happen.
Amen.
Yeah. So, okay, then you have a last word, or would you like to say to conclude?
I think I've said everything. To all the ladies, especially because in those days it was difficult to get a lady doing medicine. It's very possible. Your dreams, however big they may be, it's very possible to achieve them. Just structure out your life, plan it out, pray to God. He's always there to listen to us, and never be hesitant to take the first step. You never know who will see you, will be ready to encourage you, which scholarship you will pick the things that they like in what you're doing and try to sponsor you to reach greater heights. You never know the networks that you're going to have that is going to enable you reach that dream. And so, yeah, don't relent, don't think you're too small, just go for it. And yeah, God is there.
My turn then to say amen to that. Amen to that.
Yeah.
So that we hopefully somebody has listened, somebody has been encouraged, somebody has been educated or been informed by what we had to say here today. So I'll let you go, look after baby and husband, and plan and go back to that diary. That diary seems to be a very important thing to you.
Very.
So yes, it says it all about planning, as opposed to just getting up one morning and saying, this, that. You've let us know that it's a good thing to plan. And when you plan and when you dream and then plan accordingly, that just increases the chances of that dream reaching its fulfillment.
Exactly.
All right then, Dr. Brenda Tanyi Tal, it's been a pleasure having you on the Musings program, and we hope to have you back. We hope to have you back when many more of these things that you have talked about would have been fulfilled by the grace of God.
Amen.
All right then. You take care. Mwah.
Bye.
Bye dear. All the best.
Bye-bye.
Bye.